Most people who talk about type 2 diabetes talk about blood sugar. I learned the hard way that it also can be about kidney disease. Many people, if not most, contact issues with their kidneys if they have type 2 diabetes. I'm 76 years old. I've had type 2 diabetes for almost 40 years now. And I learned the hard way about kidney disease. But thankfully, the results are great. I now have complete control of my diabetes, and I have complete control of my kidney issues. And you can do the same thing. Or in fact, hopefully, I can help you prevent the kidney issues in the first place. And that's why I'm making this video, maybe to save you the trouble of dealing with kidney issues. And if I can't save you the trouble of dealing with kidney issues, at least I can help you deal with them like I have once you do get them. Type 2 diabetes is something that you want to make sure that you keep your A1C of 7.0 or less. And why do I say this? Well, doctors will prescribe medicine for you if your type 2 diabetes A1C is over 7.0. They may give you a little bit of time to get it a little bit lower than 7.0 or at 7.0 if you want time to just make lifestyle changes. But you won't have that much time. So it's important that you make your lifestyle changes. And I help with that in our programs. Our type 2 pivot method, our main focus is on lifestyle changes and new habits and understanding patterns. It's what it's all about. But if all that fails, or if you're just a little bit slow getting started, and I was slow getting started, and frankly, most people are slow getting started, you'll find that you can still control your type 2 diabetes and other issues like kidney disease. Some of the blood work that you need to get when you're dealing with your type 2 diabetes, not only is your A1C level, but you also need to deal with your eGFR. Your eGFR basically measures your kidney disease. You want to make sure you have that done. Now, actually, I also take creatine, a supplement called creatine. The reason I take creatine is because over the years, since I had type 2 diabetes, I have to work hard at maintaining my muscle. I no longer have to worry about weight loss. I've got plenty of that. But I do need to maintain my muscle mass. And when you maintain your muscle mass, you've got to take, well, I take creatine. You don't have to. And then once you take creatine, you have to use creatine, and you also have to include it with your muscle workouts. I do resistance training, I do squats, and I do a lot of walking. I try and do 8,000 steps a day. And I'm pretty successful in controlling my type 2 diabetes and I'm pretty successful at controlling my type 2 diabetes and my kidney disease. Now, some of the other things that you need to make sure you need to do if you do have kidney disease, if you take creatine like I do, you need to take a couple different types of tests. You have to take a creatine C test, which is a better way of measuring your kidney level function. Instead of just eGFR, you have to take a creatine C level. And then you have to take a urine test called the ACR, albumin creatine urine ratio. You take those two tests, and you take your eGFR, and you get an idea how your trends are going along. I had difficulties over the years, but now I don't have any difficulties. Doctors tell me that I'll live to over 100 before I ever have any issues with dialysis or anything like that. And I've had people who've passed away from dialysis and had gotten dialysis as a result of their kidney disease. Some of the other medicines that you need to take if you have issues with your kidney are SGLT2. I take Farxiga. And if you take Farxiga, I also take something called Kerendia. So it's important that you follow through with your endocrinologist and your nephrologist concerning these medicines. I strongly encourage you to follow through with those kind of doctors, both your endocrinologist and your nephrologist. I also take my GLP-1. These days, many endocrinologists are bypassing metformin. And the reason they're bypassing metformin is because these newer drugs, like Ozempic and SGLT2s, and there are some others, which we can go over in other videos, are more effective and really can help to control type 2 diabetes. And the reason I don't encourage berberine, which is a supplement, is because I think you need to be dealing with an endocrinologist, not just any old person that suggests a supplement. And it's unlikely that an endocrinologist will recommend berberine. So I encourage you to follow that advice of an endocrinologist and a nephrologist. If any of this sounds helpful to you, I encourage you to check out our Type 2 Pivot Method free guide, which you can find in our guide below. Thank you very much, and I hope you have a great day. Bye.